Hi, this chapter is chapter 30 and it's over safety. Patient safety is the most important initiative influencing how healthcare settings develop and implement programs for patient care. The Institute of Medicine report 2000 to err is human, which basically means that building a safer health system, which means basically to err, meaning that everybody's human and that's a possible thing. Um, Shortly after they came up with the report, which indicated that 44,000 to 98,000 people die each year as a result of preventable medical errors. Shortly thereafter, the Institute of Medicine uh, published a second book, Crossing the Quality Chasm, a new healthcare system for the 21st century. That was published back in I think like 2001. To and all of these were recommended. The report, which recommended fundamental changes in the organization and delivery of healthcare in the United States. It also identified the need to focus on introducing processes and approaches for improving the quality of care delivered to patients, including forming new rules to redesign and improve healthcare, building organizational supports for change, and applying evidence to healthcare delivery and using information technology. Much of the force behind the changes for improving safety accreditation agencies were from the Joint Commission and the Centers for Medicare and Medicaid Services, which is CMS. And they stressed the importance of error prevention and patient safety, and their Speak Up campaign encourages patients to take a role in preventing healthcare errors by becoming active, involved, and informed participants in healthcare delivery. Okay? So, for example, if you got the patients are encouraged to ask healthcare workers if they have washed their hands prior to, uh, administering care. And because that decreases possibility of infections. So the Joint Commission in 2014 developed the National Patient Safety Goals, and you'll see that as in National Patient Safety Goal (NPSG), and they're in hospitals. In hospitals, the ones that they usually really focus in on is identifying patients correctly, improving staff communication, using medicine safely, use of alarms, preventing infection, identifying patient safety risks, i.e., suicide, and preventing mistakes in surgery. Home care, identify patients correctly, use medicine safety, prevent infection, prevent patients from falling, and identify patient safety risks. And a lot of times you'll see on, like, for instance, when you are working on the floor, they may be working on one of those particular national patient safety goal, and it may have on there that they've had this type of many falls where somebody in risk management, like, because there are risk management nurses that identify that, oh, it seemed like this floor has had an awful lot of falls. So what they'll do is they'll implement something that all the staff on that particular floor work on to try to decrease the falls, and then they'll keep up with that. And it could be the same thing as far as with infection as well. maybe Foley infections, maybe wound infections, just various different things like that. So the National Quality Forum is the NQF, and it's a national voluntary consistent standards for public reporting of patient safety events, patient safety measures, and what they call serious reportable events or never events. So the serious their major focus is with CMS, and never events are what you would call basically adverse events. And that's things that should never really ever happen. Uh, I was telling you earlier when I was is for instance prevent mistakes in surgery. I remember when I had first moved down here back like early 2000, 2002. It was something on the news, and at the time uh Advent was called I don't think it was like really merged like it was, but they had the hospital that is over there north on, is it Fowler or Fletcher? But y'all know which one I'm talking about. It's had a couple different names, and at that time it was called University Community. Well, apparently there was a surgery where apparently somebody had a wrong limb removed. The one that they were supposed to amputate, they didn't. And then the one that like that. And it was like a big deal. Um, so I noticed that I see where like prior to surgery, them the everybody marking that a limb that they have like let's say they're gonna do a specific surgery, they actually take a marker and they mark the limb that they're gonna do whatever particular surgery on or whatever. So there was a lot of safety and a lot of discussion behind that. So you want to promote a culture of safety in the workplace, which basically, when you do promote that, you first and foremost have to acknowledge that there is a risk. So, gone are the days of trying to cover stuff up. Just acknowledge it. And then that way people can work on it and do things that they need to do. Fosters a blame-free environment and commits resources. So you're going to acknowledge this is a problem, and then you're going to pursue safety, and then you're not going to put the blame. Remember, to err is human, and commits resources, monies, time, whatever they need to do to make that environment more safe. So QSIN, you'll hear about QSIN, and QSIN stands for Quality and Safety Education for Nurses. Quality and Safety Education for Nurses. You'll hear people talk about QSIN, and basically the future nurses need knowledgeable skills and attitudes basically to promote safety. And there's a continuous improvement for the nurses and that type of thing. People getting certifications, people getting continuing education is essential in order to do that. And then QSIN minimizes risk of harm to patients and providers by system effectiveness and individual performance. So, the scientific knowledge base. The scientific knowledge base um, basically is, I could say, built around safety, and that's freedom from psychological and physical injury. So, and that is like a basic need, a basic human need to be free from psychological and physical injury. Healthcare provided in a safe manner, and if you given it in a safe community environment, is essential for patients' well-being. So you have to recognize like vulnerable groups. You want to reduce physical hazards in the environment. We talk about all of those things all the time, you guys. Part of when you do the check off list and you come in the patient room and you learned this when we was doing assessment, you would be like, check for safe. And that doesn't mean just look around the room per se, but what are you looking around the room for? You're looking around the room to see if anything is out of the place. You know, you're going to wash your hand, reduce the transmission of pathogens. So these type of things are very, very important in order for you to provide a safe environment for your patients. So you have what you call basic human needs: uh, oxygen, nutrition, and temperature. You want to be uh, oxygen can there's a risk for fire. You can have a low concentration, a high concentration. There could be two carbon monoxide. So we're doing all the things that we need to do to make sure that none of those things occur. Temperature. You want a normal temperature. You don't want hypo or hyperthermia, because hypothermia, could freeze, and then hyperthermia could provide a heat stroke. Nutrition. You want to make that you're storing things the proper way so that they don't spoil, proper refrigeration, and then proper preparation. You don't want dirty counters. You want to have clean things. You want to wash your hands. All of those type of things goes into play. So we're going to start with a case study on Mr. Gonzalez, who's a 68-year-old man, and he's lived alone in a senior apartment building since his wife died approximately half a year ago. And he and his wife were born in Mexico, but came to live in the United States shortly after they were married. He is retired from a produce warehouse where he worked for 37 years, and they have raised three sons. The closest son, Carlos, is 30 minutes away by car. Carlo visits Mr. Gonzalez every week to socialize and take him shopping. Okay, so that's the beginning. You got Mr. Gonzalez. Just kind of keep him in the back of your mind. There are physical hazards. You got hazards from motor vehicle accidents, things like right here, you see the picture of the baby in the car seat. They won't let you take a baby home unless you have a car seat, a provable car seat. Poison in the house. Uh, Making sure things are locked in cabinets. Free of fires, having fire alarms present, and free of falls. All these type of physical hazards can come into play, and you need to do the type of things that are necessary in order to make sure the people are safe. Because, like for instance, a motor vehicle accident, uh, they say that until uh, they are, I think the minimal age is two. I mean, they should be up through two in a car seat. Okay. Uh, you got things like poison, like ingestion of poison and chemicals and cleaning agents. Uh, what group would you look at a lot about that? You would look at like toddlers and things, because you know that they get around and they go up under cabinets and that type of thing. So that's the you would look at them children. Falls. uh, most common among adults 64 years or older. So you want to make sure they don't have fractures or injuries and low standing furniture that they can bump into and uh, 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 I mean, you want to have in contact with accident that can cause falls and stuff. And then, of course, you got disasters, and we talked about pathogen, and that pathogen, and that kind of stuff is, when you think in terms of like isolation and doing all the things that you're supposed to do. So, you have disasters, and some of the disasters that you have can be natural, which you'll have flood, hurricanes, and tornadoes and that type of things, and then you'll have some that are man uh, made disasters. You know, like bioterrorism or something like that. So, and chemical warfare and that type of thing. So then you have, of course, pathogen transmission. You're going to try to be safe. You're going to try to make sure people are immunized like they're supposed to be immunized. And that immunization is the process by which resistance to an infectious disease is produced by acquiring active immunity. Okay. Uh, so that's a very important thing. And then you have pollution. Pollution in the air, in the land, in the water. So chemical waste and radioactive waste and that type of thing can damage, you know, our resources out there. Quick kick quiz. While caring for a child, you identified that additional safety teaching is needed when a young and inexperienced mother states that what? So, what is the mother stating a teenager needs to practice safe sex. A 3-year old can safely sit in the front seat of the car. Children need to wear safety equipment when bike riding. Children need to learn to swim even if they do not have a pool. So, basically, a 3-year old can safely sit in the front seat of the car. She's not uh, I would put the child in the rear. They talk about children being under the age of 13, being strapped in and being placed, in the back of the car if at all possible. So, B would be the correct answer. So, going back to Mr. Gonzalez, who's generally healthy but has decreased visual acuity, hearing loss from the noisy warehouse job, and he got a little arthritis. He expects to live at least as long as his father, who lived to be 92 years old. Since his wife's death 6 months ago, Mr. Gonzalez has attended Catholic Mass every day at his parish church where his wife had attended daily. Okay. Nursing knowledge base factors that influence patient safety. Developmental level, you guys know injuries as a major cause of death during infancy, especially for children 6 to 12 months old. The leading cause of injury for infants are falls and ingestion injuries like poisons and that type of thing. As far as school age children, um, I would say contact sports, motor vehicle, and bicycle injuries, and that type of thing, and playground safety, and thinking about stuff like helmets and that type of thing. Adolescents who are more independent and things like that. You could look into things like physical and psychological changes that got to do with peer pressure, and as a result of them possibly being exposed to drinking, smoking, alcohol, drowning, motor vehicle accidents, and that type of thing. Um, Adults uh, basically depends on they can have a number of different types of disorders, and they talk a lot about if you was to read the book, talks a lot about use of alcohol and drugs and stuff like that. So risk factors can be your overall lifestyle. The, you could operate machinery on a job. You can have impaired mobility that where you need handicap things to assist you. You may have sensory impairments like communication or language barriers, which could make you more prone to have injury. Cognitive impairments. If a person has delirium or dementia or depression, that exposes them to more injury. And then, of course, if you the literacy that you have that goes along with safety awareness is an important thing that influences safety. So Joni Green is a 25-year-old married mother of two, is currently a nursing student. As part of the clinical environment, she and her study partner are conducting health screenings and providing health promotion education for the residents of the apartments where Mr. Gonzalez, that we just discussed, lives. Okay. Now, risk in healthcare agencies, you got chemical exposure. If that happens, they have what they call MSDS sheets, material safety data sheets that you need to fill out, as well as they come and they basically get rid of that safety exposure as soon as possible. You have falls, and there could be intrinsic factors and extrinsic. Intrinsic mean that there's things within you, like visual disturbance or mental impairment or gait balance or polypharmacy, people on medicines that make them woozy. uh, Extrinsic risk factors are things like the room is cluttered or there's a loose cord or something like that where you trip over it. So know the difference between the intrinsic and the extrinsic risk factors. Patient inherent accidents. Basically what that means is stuff like self mutilation, setting fires, uh, uh, maybe I accidentally shut my hand in a door or something like that. Procedure related accidents. Procedure means doing nursing. Maybe, maybe a nurse is doing something and she hurt her back because she's not using right the right body mechanics, you know, when she was lifting a patient or something like that. Or maybe an accident with giving medication. That's a procedure related accident. Equipment related accident is stuff like electrical hazard. Maybe that's a malfunction. Maybe IV fluid going in because the equipment is uh, hasn't been updated and stuff like that correctly. So those are the type of accidents that a person could have. A quick quiz. A nurse floats to a busy surgical unit and administers the wrong medication to a patient. This error can be classified as what? A poisoning accident? No. An equipment related accident? No. Accident related to time management? No. What it is it's a procedure related accident. Remember, I told you, like people giving the wrong medicine or something like that. Something failed in her procedure. Did she not double check the medicine? Did she not look at how you're supposed to administer? You know, did she look at all her rights of medication? Okay. Critical thinking, knowledge, experience, attitudes, and standards all play a role as far as safety. Okay, so you got to know about the knowledge part, what safety risk and what developmental stage a person is in. Experience will tell you, it's like a thing, like you say, a lot of times from experience. I've told students before, I've had students before make medical um uh accidentally give the wrong medicine, and that person experience uh will let them basically say, I'm never gonna do this wrong. I'm never going to skip over a stage when I'm checking the medication. So clinical and personal or experiences or seeing people go through things or things having certain outcomes, you know, like evidence-based practice, all of that plays a part in the experience. Attitudes, whether or not you take responsibility, whether or not you're disciplined, whether or not you have perseverance, like to keep going, has a lot to do with safety, and whether or not you're following ANA scopes and standards of practice, code of ethics, and any regulatory agency standards. So the person would use the nursing process and they would assess risk to patient safety. They would look at the risk factors, the home environment, do a fall assessment, and what type of hospital type equipment is being involved. You always take older adult consideration into when older adult consideration when you're practicing, you know, and I mean you got to do things, uh, and they have tests, like for instance, a fall test. They have a test called Get Up and Go, you know, uh, to see uh, it, if person can get up and go. And what they do is they have the person stand up, uh, stand still for a moment, walk 10 feet in a line, turn around, walk back to the chair, turn around, and sit down. And normally a person completes that task, they say within about 10 seconds, because it's like boo, 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 boo. But they say abnormal is if the person is more than 20 seconds. That's to get up and go. So there are other considerations. And you also have to always take in consideration the patient's expectations when it comes to safety. You don't want them to not feel safe in their environment. And what you need to do is ask them, what can I do to help provide you safe care? What is your expectations? And they will tell you. Okay, so nursing diagnosis for patients with safety risks. There are risks for falls, impaired home maintenance, risk for injury, deficient knowledge regarding safety risks, risk for poisoning, risk for suffocation, risk for trauma. All of these are safety diagnoses. And you can see how deficient knowledge, there's always something that you can teach a person regarding safety, you know. So all of these, you can see how in each category and all the multiple system things that we talk about when we talk about patients, how it can end up with a care plan. People are very complex. So it shouldn't be any reason why anybody should say, oh, they're just wonderful. There's no, everybody has something that you can pull out, everybody. So Joanne has discovered through screening Mr. Gonzalez. Now Joanne is the nurse, has decreased, or nurses through, has decreased visual acuity, and he has not had a new pair of glasses for 3 years. He fell in his apartment about a month ago, but did not have any injuries. Gait assessment reveals that Mr. Gonzalez does not pick his feet very high up off the floor, and his movements are stiff. Now, remember, Mr. Gonzalez said that he had arthritis, okay? Plus, his visual is what seems to be a little bit impaired. And he was lucky when he fell and didn't have no injury. So, the nurse, by doing her safety assessment, she's keeping all of that in mind, right? About teaching. So, you're going to have a nursing process and planning. You're going to have goals and you're going to have outcome. You're going to set your priorities and you're going to have collaborative care. Your goals and outcomes should be measurable and realistic. What you want to work on. What do you think is the most crucial thing that you want to work on the most quickest? When you're looking at it, I would think to prevent falls, and get him to a place to prevent falls. So you're going to set priorities that are realistic for this man, and you're not going to overwhelm him. So therefore, you may collaborate with a physical therapist to help build his strength, an occupational therapist to give him ways to get around and use things that are, because occupational therapists do wonderful work, as far as assistive devices. And then a social worker to see if he can get any assistance in the home or if it's any other things that we have out here in the community that can assist him. And then as far as with the patient and his family, and you may be setting appointments with the ophthalmologist or doing all the different things that you need to do. Okay, so you're going to have implementation of passive as well as active um, health promotion as far as with the patient. And so therefore, uh, that means that you're putting everything into place. So passive strategies, for instance, include public health measures like making sure that sanitation and clean water laws. But active strategies is when an individual actually does things on their own as far as lifestyle, like wearing seatbelts or installing lighting or walking along a certain path or participating in a wellness program. And then developmental interventions, which are tailored toward whatever group that you, for instance, are dealing with. Like, for instance, if you're dealing with adolescents and you want to talk about safety, you might have to get into bullying. You might have to get into suicide, gang violence, electronic aggression, or something like that. So you will tailor it to meet the community that you're serving. So that's what they mean when they say developmental interventions. Environmental interventions means basically you looking at their environment, making sure that their basic needs are met. We talked about that, about air and water and temperature and and food and doing general preventive measures. So so the acute care, you want to work on falls. A restraint is a use only as a last resort. And there are two types of restraints. You can use a chemical with medications to sedate somebody, and you can use physical like a belt or a wrist restraint. But you have to have those renewed every 24 hours, and you have to take them off, especially if they're physical restraints, every, I think, 2 hours, and make sure that you are not impeding a person's circulation. Side rails as well. Fires, electrical accidents, radiation, and disasters. All of these are acute care. So you see a safe patient room environment right here. We saw where we got the room, it's well illuminated. They're trying to say basically it's well lit. A call button is within reach. Non-exit side rails up for support. Non-exit ones only. Otherwise, it's a restraint. You got the bed alarm set. So the bed alarm will go off and let you know if a person is trying to move. Non-skid footwear, if available, and then a bedside commode placed alongside the bed. So that's an example of a patient room environment that's safe. And also, let me go back. Look at how low the bed is. Okay, very good. Quiz, quick quiz. A newly admitted patient was found wandering the hallways for the past 2 nights. The most appropriate nursing interventions to prevent a fall for the patient would include what? Use an electronic bed monitoring device. The patient was found wandering the hallways for the past 2 nights. They didn't say that, so the patient is probably a little confused, but they didn't say that he was at risk. Uh, they didn't necessarily say that he was falling. You're not gonna raise all four side rails. Uh, use electronic because as soon as he moves up, that alarm goes off just like a car light, and then somebody can go in there and check and see what he's doing. Okay. The son Carlos has purchased a medication organizer that Mr. Gonzalez has not used because he is concerned he will make a mistake. Okay, so Mr. Gonzalez is unable to read the labels on his medication bottles. What additional interventions are justified as brought for Mr. Gonzalez? Well, since he can't read the medication bottle, Mr. Gonzalez may really need, first of all, you got to get his eyes and stuff checked and make sure his seeing is the way it's supposed to be. And you can also have somebody sit with him once a week or and put his medications into uh, a pill container because they do have them depending on how many they have them for up to 4 times a day, 7 days a week. They do, they have those type, or but either way it go, you need some way to know that for him to take his medicines. So sometimes it's a good idea to involve the family and have them help set up their medicines. And then you you have them call and make sure. Dad, they didn't say the man had dementia. Dad, did you take your medicine? Well, I don't know. Well, today is Tuesday. Look under Tuesday and see if you took your morning medication. And not saying that you have to do that every day, but you just doing it just to see if he's on track. So, uh, what additional health behavior can be encouraged by Mr. Gonzalez, and what effects could this health behavior produce? Basically, you have to get him more confident and taking some type of responsibility for his action. And when he see that he can do it successfully after you help put things in place to make it possible, then I think that he will want to play more of a better role and part in his own care, because most people like independence. So in order to evaluate, you have set your goals, you know your goals were realistic, and you wanted to reassess the patient's condition. So you evaluate and you revise or discontinue your interventions based on whether or not you met them. And so you want to see, have based on your expectations and the patient expectations, have they been have the family been met? And that's why it's really good to talk to them, because everybody needs to be on the same page. And you don't want to set things so high that they fail and then they go back into like become a recluse about their care, or feel like they can't do it. You want to have them accomplish small little things at a time that they can do. So it's been 2 weeks since Joan implemented the panic care. Joni will observe Mr. Gonzalez's environment for elimination of threats to patient status, and she will assess motor, sensory, and cognitive status for appropriate environmental modifications. With regular exercise, Mr. Gonzalez has found that his walking has improved and how he feels safer about leaving the apartment. So she must have got a physical therapy in there. The new medication labels and organizers have made it easier for him to tell his several medications apart. He reports that his vision is much better with his new glasses, and he understands that he is able to make changes in his environment that will keep him safe. Mr. Gonzalez has been injury free and plans to live a ripe old age. So, all the things that I had said, I remember I was saying maybe we need to get that therapist in there. Maybe we need to have his vision checked. Maybe you need to, were things that were put into place, and it seemed to have been pretty successful. So, to assure patient safety, communicate clearly with everybody in the health team. Assess the patient's risks and use the best evidence. Incorporate priorities of care and preferences that you get from the patient. And when performing the skill in this chapter, always try alternatives before using a restraint. If a restraint is needed, always use the least restrictive device. And because restraints limit a patient's ability to move freely, make clinical judgments appropriate to the patient's condition and agency policy. Okay, so that's what you need to know about safety. Okay, so I'm done with that.